My name is Nick Cunniffe and I'm a consultant neurologist based in Cambridge specialising in multiple sclerosis. And today we're going to talk a little bit about some of the visual assessments that are increasingly important in making the diagnosis of multiple sclerosis. The visual system is commonly affected over the course of someone's journey with multiple sclerosis, often at the earlier stages, but can become manifest throughout any point in that lifetime of someone living with MS. And we use various different mechanisms and methods to try and measure that. We can use MRI scans, we can use tests of visual function such as the visual evoked potential, or tests of nerve structure. And one of the personal examples is Optical Coherence Tomography, or OCT.
Okay, I'm starting now. And you might just want to look at the blue cross on this inside the camera.
This is a really commonly used test that is often found in high street opticians. And what it uses is light to measure the cross-sectional structure of the retina, the light sensing area at the back of the eye. And we can use a light stimulus and quantify the reflection of that back from the eye to segment and look at different layers of nerve fibers at the back of the eye. Now, we shouldn't see any myelin in the eye itself, but we can see the nerves that are going to send their nerve fibers, their wires, back towards the brain. And it's those nerve fibers that are going to lose their myelin, and we can then measure the loss of nerve fibers as a consequence of that in the eye. So essentially what we see is less nerve fibers or thinning in the back of the eye. And that's one of the reasons why OCT is so helpful. So as part of the diagnosis of MS, some people may be invited to have an OCT test because it allows us to measure whether or not MS has affected one of their eyes. And we can do that by doing the test, which takes about 5 minutes at the most, and comparing the structure of the nerve fibers between the left and the right.
And now I will move that cross. So that's going to be on your left-hand side, okay?
Because we know that if there is a significant difference between the left and the right, that's a very clear marker to us that MS has affected one of the optic nerves, the wire that leads into the back of the eye, that MS has affected one of those nerves at some point in the MS journey. So this is an example of an OCT scan once it has been performed. And what you can see on the top left-hand side of the screen here is the optic disc. So this is the area of the retina that is going to lead towards the optic nerve, the nerve fiber that's going to go back towards the brain from the eye. And what we've done during this test is we've centered our picture on the optic nerves there. And we essentially have almost put a cookie cutter, like you would if you were baking, into the eye and that circle there, and then looked at that area in cross-section on the right-hand side. And we are particularly interested in the top layers of the retina, because those are the ones that have the nerve fiber, the cells, but also the axons, the wires that are going back towards the brain. And we can look and see if there's any thinning or loss of nerve fibers as they go into the optic nerve. This layer here, you can see between the red and the kind of teal colored here, it is the retinal nerve fiber layer. This is the nerve fiber layer that we're particularly interested in people with MS, because we know that when you're living with MS, this tends to thin. And when you've had optic neuritis, this tends to thin as well. And like I said before, we would compare the difference between the left and the right for this value. In parallel, we also do tests not centered on the optic nerve head itself, but actually looking at what's called the macula, the central point in our vision. This is the area where our vision is best. This little pit you can see here. And if we look at the nerve fibers here, we can also get some really useful information about not just the wires coming from those nerves, but actually the structure of the cell bodies themselves. So in brief, a OCT scan allows us to look at cross-sectional imaging through the retina and allows us to quantify any loss of nerve fibers as is often seen in MS.
You can sit back, that's all.
Why you may have an OCT scan. It checks for optic nerve damage linked to MS. It compares both eyes for signs of past inflammation. Measures thinning of the retinal nerve fiber layer. accesses the health of the nerve cells in the back of the eye, provides clear objective markers of nerve changes. It can help to support an MS diagnosis.